Dear Dementia Caregivers, Kristen Galloway here, occupational therapist and certified dementia care specialist. Today we're going to talk about incontinence and dementia. So this is a difficult topic, of course. Lots of individuals with dementia, and actually the majority of them, unfortunately, as the disease progresses, develop difficulty maintaining bowel and bladder control. Today, what I'm going to talk about is mostly bladder control, although bowel is involved with that as well, surprisingly, which I'll get to that in a moment. So stick with me. It's kind of a long topic, but I think you'll find some really valuable information here. I'm going to give you 5 great strategies to use to try to help the person that you're caring for be able to maintain continence and dignity for as long as possible. So let's dive right in. According to recent research, somewhere between 11 and 93% of individuals with dementia develop bladder incontinence. So that's a pretty significant number. And obviously, incontinence, which is considered any amount of involuntary leaking, incontinence makes caregiving just that much more difficult. You're already in an overwhelming situation that requires a ton of time and effort, and incontinence just really kind of lays on just another level of difficulty and complexity to caring for someone with dementia. So let's get right to the strategies. The first strategy is called timed toileting or timed voiding, and it is a strategy that has been pretty extensively researched. It's very effective, particularly with individuals who who begin to lose the sensation, that urge sensation. They can't really tell, kind of sense that feeling of when their bladder is full. And so this is just simply a matter of setting up a toileting schedule and making sure that that person uses the toilet every 2 to 3 hours during the day. So it might be something where you could set reminders in your phone so that you remember to take them to the bathroom. And so this is sometimes easier said than done. People with dementia don't like to be told what to do. And so sometimes we need to use a strategy let's just go for a stroll, let's go for a walk, or let's go get a snack, right? And on the way to get a snack, we happen to walk past the bathroom and we say, oh gosh, there's the bathroom right there. Let's go ahead and go since we're right here. And then we'll go get our snack. So sometimes it's just a matter of kind of setting out a strategy where you can encourage them to happen upon the bathroom and then go ahead and be able to use that. So timed voiding is not used at night. It's only used during daytime waking hours. At night, we prefer to allow the person to sleep unless they happen to be awoken with the need to go to the bathroom. And then of course, we would help them, assist them to be able to do that safely. But it's not a strategy that we use overnight as far as doing it every 2 to 3 hours. This is only a daytime strategy. Strategy number 2 is hydration management. So I have another video on this, which has chock full of really great information on encouraging hydration in individuals with dementia, which can be another challenge in itself. But just to underscore the idea that hydration is very important for a lot of reasons, but particularly for bladder and bowel health and for bowel and bladder continence. Hydration is important, and you would think, maybe intuitively that you don't want to give too much fluid because that would make them have to urinate more frequently. But actually, as long as you find a good balance of fluid, it's actually the opposite is true. So the way our urinary system works is our kidneys are constantly making urine, 1 drop at a time, but it's a constant process. And so that urine, that 1 drop at a time, is simply flowing down into the kidneys, from the kidneys to the bladder. And as the bladder begins to fill, it starts to stretch a little bit, and it kind of sends a signal to our brain that says, okay, it's time to go to the bathroom. And you get that first sensation or that first urge that you need to use the bathroom. So the way that works is that if we are dehydrated, the urine that the kidneys produce that's stored in the bladder is acidic by nature. But if we're dehydrated, it's even more acidic, which is irritating to the lining of the bladder. And it can cause increased urgency and increased frequency with having to use the bathroom, and potentially even leakage when that is the case. So obviously we want to stay well hydrated, and check out my video on hydration tips and strategies to help with that. Tip number 3 is bowel management. Okay, so I know this doesn't make a whole lot of sense, managing our bowels to manage our bladder, but actually the end of the bowel, which is the rectum, and the bladder live side by side in the pelvic cavity. And so they can certainly affect each other. And If someone is constipated and there's a kind of a backup of waste product in the rectum, that can kind of stay in there, kind of cause the rectum to stretch a little bit, and put some pressure on the bladder. Again, they're neighbors right there in the pelvis, and one can push on the other and create irritation. So we don't want to irritate the bladder to increase that frequency, that urgency, and the potential for leaking. So we want to have really good bowel management, and make sure that the person is not constipated, make sure that they are staying well hydrated, that they're using, that they're having a bowel movement, hopefully every day, or at least every other day, so that we reduce the potential of irritating the bladder. I'll be making a separate video on constipation management because that's a whole other topic in itself, but just a couple of quick tips for managing a healthy, happy bowel is, again, to stay well hydrated, to eat plenty of fruits and vegetables, which are high in fiber and help to maintain bowel health and bowel regularity. Pick a regular time each day to sit on the toilet and attempt to have a bowel movement. A lot of folks like to do this in the morning, shortly after breakfast, because our bowels tend to be stimulated within about 30 minutes or so of when we eat something. And so that would be a good time to have kind of a normal toileting routine for your loved one with dementia. And be sure that they make time to exercise every day, whether that's taking a short walk, or doing some type of approved exercise program that their physician has authorized, whether that be Tai Chi or chair yoga or some type of gentle movement that encourages increased blood flow and will stimulate the bowels. Tip number 4 is to use cues, particularly visual cues, to help your loved one with dementia remember that it's time to go to the bathroom. Putting a sign on the bathroom door to indicate that that is where the toilet is very helpful. Leaving the door open so that they can see into the bathroom and see that the toilet is right there. Sometimes that can serve as a good reminder. And of course, verbal reminders to do the timed voiding or the scheduled voiding. So, okay, it's time to go ahead and go to the bathroom, or it's time to have tea or a snack, so let's go ahead and go to the bathroom first and then we'll get our snack. Those are all great strategies to remind the person to stay regular with their toileting. And the final strategy is to make toileting as easy as possible for the person with dementia and for the caregiver. So the individual with dementia may have many barriers to toileting. For example, they could have decreased hand function or dexterity in their hands, which makes it difficult to undo fasteners such as buttons and snaps and zippers. So they may find that they're frustrated with that aspect of toileting and having a hard time managing their clothing. You can either offer assistance with this, or sometimes just to make it easy for them to be independent with the clothing management piece of it. There are adaptive types of clothing that have velcro closures or elastic waist pants even. Sometimes are just the thing that they need to be able to manage the clothing easier themselves. Another strategy for making toileting as easy as possible is to make sure that the toilet is an appropriate height. Some of the older models of toilets sit fairly low to the ground, and so it's difficult for someone with hip pain or low back pain or knee pain to get on and off of the toilet easily. So using a raised toilet seat might be an option. And of course, grab bars to help the person more easily get on and off the toilet safely. Some individuals with dementia may also need help with toileting hygiene, so cleaning themselves after they use the toilet. And so there are several options for that. You can help them out as a caregiver if they will tolerate that. If they are able to clean themselves, they have wrist and hand range of motion and trunk rotation so that they're able to reach back and clean themselves. Sometimes just using wet wipes, fragrance-free moist wipes will help them to be able to do a better job of cleaning up, or to help you as a caregiver be able to do a better job of getting their skin clean and dry. Versus traditional toilet paper, which can be a little bit abrasive if you're having to wipe multiple times. And then of course, using gloves if you're a caregiver can make the task a lot more hygienic and a little bit more palatable. So I do recommend gloves and wet wipes to caregivers if they are having to assist with perineal care after toileting. So this is just kind of a brief synopsis of strategies to help with continence for individuals with dementia. It's a complex topic and there's a lot to unpack. And of course, each individual with dementia will have different needs, and some days will be different than other days, as you well know as caregivers, and so different strategies may work better at certain times than others. So I just wanted to give you kind of a big overview of some simple strategies that you can try to implement right away. And of course, be sure to take a peek at my hydration strategies video and the constipation management video that I will be posting shortly. Please like and subscribe if you enjoyed this content.